Welcome to episode 8 of For the Good of Man podcast, your go-to source for all things men's health. In this month's episode, we're excited to welcome Dr. Roger Khouri, who will dive deep into common myths and misconceptions about erectile dysfunction, or ED. As a leading sexual health expert, Dr. Khouri will clarify some of the top misunderstandings surrounding the cause of ED, as well as the available treatments. He'll also address questions submitted by our listeners, providing a comprehensive view to help our audience better understand ED and their treatment options. So sit back and join us as Dr. Khouri debunks ED myths and provides practical guidance on overcoming this common issue.
Start us off. Is ED always a psychological problem or
not? So no, anytime you hear always, it's probably not true. Obviously, sometimes it is a psychological problem. And almost always there is a psychological component to it. But to say that it's entirely psychological on everybody is obviously not true. In younger men, like especially men in their 20s, yes, it usually is almost entirely psychological. And the thing behind it, the way to sort of understand it, is not that you're crazy or something like that. It's just the fact that the nerves that control the erections are very different than the nerves that, say, control your hand. You know, you can tell your hand to go up whenever you want. You can't do that for your penis, right? There's this whole autonomic nervous system, or you could call it the automatic nervous system, where your brain essentially assesses the environment and makes the appropriate changes that you don't have to think about, right? When you walk into a dark room and your pupils dilate, you don't have to think about that. Your brain is just making those changes. And so a part of that nervous system, obviously, is the fight or flight response that we're all familiar with. And so, interestingly, when the fight or flight response gets activated, part of that response is to shut down any erection, which makes sense, right? You know, if 1,000 years ago, if our ancestors saw a bear or something, that's not the time to have an erection. Blood needs to be sent elsewhere. So if when you're engaging or about to engage in sexual activity, there's this sort of adrenaline response or stress response, either there's performance anxiety, there's relationship stress, there's just general life stress, any of those things can basically automatically activate this fight or flight type of response from the automatic nervous system and shut down the erection. And what we see often in young men is that if they have this problem, then the next time they're more worried, obviously, and so then they're more anxious, and then it happens again, and they can really dig themselves into a hole. So there's definitely a psychological component, especially in younger men. But in older men, there tends to be more of a component that's just simply vascular. They're not getting the blood flow to the penis. So no matter what type of psychological status they're in, it's just a matter of plumbing.
Some great points there for sure, especially about going back the second or third time and having that bad experience in the back of your head. I'm sure that wouldn't help. I guess as a follow-up to that question, what would be some methods of treatment or home remedies to work this psychological issue out before you visit a doctor and start looking at some of the other things that you could do?
Yes. So one is just awareness, sort of being aware that a lot of the problem could be the stress and anxiety. But oftentimes even the awareness is not enough, and you're still stressed and anxious. So oftentimes, even in a kid who's 20 years old and has no vascular problems, we'll give them the pills like a Viagra or Cialis to basically boost their blood flow. And those kids, they take those pills, and even if they are having a little bit of anxiety, they can overcome it with the pills, and then they can sort of get their confidence back, and often don't need to keep taking the pills long term. And so that is a good option. And now with HIMS and all of these other ways to get these pills without having to go in to see a urologist, it's very easy to get these pills and at least give that a try and see if that can help you sort of overcome this psychological component.
So, following up with this question here, this person says, if I am having trouble getting erect, does this mean I do not have sexual desire?
It could be, there's this whole concept of low testosterone causing a low libido. And so if that is a component, it's very easy to check a testosterone level. Just a blood work that any doctor can order. It just has to be checked before 9 a.m. And if the testosterone level is low, it just needs to be checked again. And if it's low twice and you have symptoms, then we can talk about testosterone replacement. But oftentimes people will have these symptoms and we check their testosterone and it's normal. But it's harmless to check. If the testosterone is normal, but you feel like you're still having this problem, then it does not necessarily mean that you have an issue with desire. It could just be the same issue with anxiety, stress, or if it's an older patient, they can have be in the perfect mindset and have all the desire in the world, but like we said, they're not getting the blood flow to the tissues. So sometimes that can cause them or their partners to think that there's an issue with desire or not being attractive to their partner, but it's a separate issue.
Following along the same line, having one bad night, one bad experience, leading someone to believe there may be something bigger at play. This person says, I was unable to get fully erect one night after drinking. Does this mean I have ED?
So yeah, that's an old term and it's very real. If you get too intoxicated, you definitely can have issues with erections, no matter your age or anything else, and that doesn't mean that you have ED. Yeah, so if that just happens one time, then no, there's nothing really to worry about. As we were talking about, that can cause people then to be anxious or worried the next time, but that's sort of a normal response to being intoxicated, that things don't work properly. Interestingly, there is probably a sweet spot, so to speak, where being maybe a little bit tipsy likely helps people to overcome their anxiety and actually allow them to have less issues with ED.
So, this is going to keep leading us down the path of ED talk here. This question here is erectile dysfunction always a permanent condition, or can it be temporary?
Can be temporary, especially like we talked about the psychological components you can help overcome. And even if it's a vascular issue with diet, exercise, and controlling blood pressure, diabetes, it definitely can improve with time. Now, it tends to get worse with age, just generally speaking, but that doesn't mean that it can't get better, especially if you make lifestyle changes.
Just following up on those lifestyle changes, is there any specific group, whether that's diet or physical activity, that you'd focus on rather than the others?
Yeah, I mean, if you're diabetic, then that's the first thing to fix. No questions asked. If you have diabetes, you got to get that under control because then you're going to get ED and it's going to get worse fast. For most guys who don't have diabetes and just have run-of-the-mill ED, I would say cardiovascular exercise is likely the thing that's going to help you the most because it's essentially, like we talked about, it's an issue of blood flow. So the same way that would help you with your heart, it helps with the blood flow in your penis. And you don't have to start running marathons, but just a little bit of cardio on a daily basis has been proven to help with erectile dysfunction.
I know you just mentioned diabetes as being a main factor that can contribute to erectile dysfunction at an earlier age, per se. What other common medical conditions would you say can also lead to erectile?
Smoking is a big one. Smoking is very bad for your overall circulation. And so, if you just quit smoking, likely you'll notice an improvement in your erections. High blood pressure has been shown to be associated with it, but oftentimes the blood pressure medicines also can cause ED. Obviously, we don't tell people to stop their blood pressure medicines because that can cause heart disease and other problems in the future. If you can control your blood pressure with diet and exercise, then that will improve your erections for sure.
Alrighty, and snowballing off of that question, if I have been diagnosed with ED, is this a sign of an underlying health problem I should be concerned about?
Potentially, yes. So men who have ED are more likely to develop cardiovascular disease in the next 5 years compared to men who don't have ED. And that's because they share a lot of the same risk factors, right? Age, tobacco use, high blood pressure, diabetes. All of these things are bad for your overall circulation. So this is not just about sexual health. If you have ED, there's a chance that you need to be worried about your overall health. And so for a lot of men, this is a wake-up call to start changing their lifestyle, going to see their doctors to not just treat their ED, but to prevent heart disease in the future.
We talked about using a Viagra or a Cialis, PDE5. Is Viagra or Cialis the only solution for ED? True or false, and why not?
So that's false. We've talked about the other lifestyle changes that can help, but there's other treatments aside from the pills. There's a penis ring. I don't know if you've ever heard of that, but cock ring is sometimes called. You can buy these at any pharmacy next to where they sell the condoms. It's basically a silicone band that goes around the base of the penis that helps to keep the blood in. That can help for some people. Mild ED, especially if the issue is more that they're losing their erections. There's a vacuum device that you've probably heard of, that basically the penis goes into a vacuum chamber, and then you pump the air out of the chamber, and that vacuum helps pull the blood into the penis. That's often used with the penile ring. There is the injections, where you inject the medication directly into the penis. That's pretty much only used when the pills are not working or people are having side effects from the pills. There's a penile prosthesis, which is, for severe cases that aren't responding to anything else. That's pretty much the whole list of options. Step one is lifestyle changes, diet, exercise, sleep, stress management, stop smoking, all of that. Step two is usually the pills, which are very safe to take as long as they're taken as prescribed. And then step three is these other options like vacuum devices or injections. And then step four is penile prosthesis.
That sounds like it just about covers the whole ED toolbox there. Bit of a follow-up to number 5. So I know you said that smoking definitely does hinder erectile function because it impairs blood flow in the body. But would you say, in your experience, you've seen an influx of patients who smoke/vape and are complaining about erectile dysfunction?
Yeah. The vaping has become extremely popular now. People think that because they're not smoking cigarettes that it's healthier, but it really has not been shown to be healthier. One, it has potential risk for the lungs, but two, you're still getting the nicotine, which is a blood vessel constricting drug. And so, yeah, we do see a lot of younger guys who are vaping a lot, who are having ED, especially guys that are not really taking care of themselves. They tend to go hand in hand, right? People who vape regularly are also tend to be people who aren't watching their diet or exercise. So you see that a lot, and it is seen in young men too.
Definitely very interesting, and I'm sure there will be some studies and some work coming out about that in the years to come.
So I'd say one myth that I hear a lot is that the pills like the Viagra or the Cialis are going to cause heart disease. People worry
Okay.
that they're going to get a heart attack or something from taking these pills, or they're going to become somehow dependent on them. They're going to cause a problem, and that's just not true. These pills are very safe. There's a lot of men who are taking them without any issues. The story of somebody sort of taking a Viagra and then having their heart stop or something, you're generally talking about somebody with a very significant heart disease, somebody who gets chest pain when they exercise and takes nitrate medications for chest pain. And somebody who probably should not be having sex in the first place because it's too much exercise for them to begin with. And so they're doing all this exercise. They're taking these nitrates, which are blood vessel dilating medications when they get chest pain, and they take Viagra or Cialis, which is also blood vessel dilating medication, and they have a bad heart to begin with. So that is very dangerous. But if you're just a regular guy, maybe you have high blood pressure or something, and you take these pills, it does not increase the risk of heart disease at all. And actually, in the biggest study we have, it shows a decrease rate of heart disease in men taking these medications. So I think that's a big roadblock for a lot of guys. They're suffering with ED and they don't want to take these pills because they think it's going to make their heart stop. And it's really not true. As long as they're getting it from a doctor who's reviewing what other medications they're taking and their other medical conditions, and they're taking it as prescribed, they're very safe medications. They've been around for a long time, and there's millions of men who have taken them. It's not always a psychological problem, but there usually is at least some psychological component. And the take-home message that I give to ED patients is that there's always something that we can do. There's no reason for you to be suffering or for your partner to be suffering alone. There's always something we can do, whether it's pills or a vacuum device, injections, or even a penile prosthesis. There's very few people that are out of options where there's nothing they can do to get their ED treated. And a lot of what it is lifestyle changes, which will help improve your quality and longevity of life in the future.
We'd like to thank you for listening in to this episode of For the Good of Man podcast brought to you by MenMD. We hope you found this exclusive episode to be informative, but please remember, if you have a question of your own that you'd like answered on a future podcast episode, you may submit these questions on menmd.com/podcast. Please be sure to join us next month as we continue the discussion revolving around men's health, this time discussing post-prostatectomy care such as optimal timing for VED therapy and implant considerations.